There is no particular age for liver problems, it can come anytime. Doctor, what are the common liver problems you face in your clinical practice?
Actually, liver is the largest organ in the body, even the largest gland in the body. So it's have its own major functions in the body. Mainly, it is a very big detoxifier. That is actually it is filtrating each and every type of blood cell, and it is detoxifying each and every minute of the body. And the second thing is it is anabolic. It is regulating the digestions and all. But in my clinical practice, grade 1 and grade 2 fatty liver is the major issues that I am facing, because it is very common for the elder as adolescents age groups and even in the senior citizens also. The second thing is we have very familiar with that is the cirrhosis of the liver. That is after the untreated grade 2 fatty liver or 3 or 4, it is saturated, it is get into the next level like cirrhosis and all. Cirrhosis is of two types. It is alcoholic and non-alcoholic is there. So it depends upon the patient's condition. We have to manage like that. But first we have to be very careful with the liver, fatty liver problems first. We have to manage with thoroughly because that is the baseline of the problem. Second thing is liver is a very silent organ. If there is any problems in the liver, definitely we will only identify in the later stages only. Try to fix itself only, because in the blood parameters for some other causes when we are taking some liver parameters will be very high, then only we'll identify that the problem is there or maybe in the worst condition, because 90% of the liver problem is asymptomatic, because there is will be no any pain or anything, only a pot bulging, digestive issues, sleep disturbances like or swellings in the legs may be the common factors that will manifest, or they will give some symptoms of the liver problems. But most probably the peoples will neglect these conditions and all. So we have to be very keen for the early diagnosis of the liver problems. Then only we can manage very effectively with our medications and all.
Doctor, your views?
Well, liver, as the doctor said, liver is one of the most compromising or most protective, self-protective organ in our body. Like, it will take maximum damage to itself to protect our body, and it will try to heal itself without informing us. So the major functions of liver is metabolism and detoxification. So any toxins which enter our body is purely removed by our liver. And the third function is clotting factors. So it will regulate our clotting mechanism in the body. So once the liver is damaged, the clotting mechanism fails, and it also causes the circulatory issues. And the another main function is metabolizing of sugar. So basically, we have to care to protect the liver by regulating many things. The first thing is timely, high fiber, less sugar diet. It is the most important thing we have to follow. Then alcohol, reduce the use of alcohol, if possible completely withdraw using all the preparatory precautions. A sudden withdrawal will also damage the liver. Okay. There are many parameters to check the liver functioning, and actually all the parameters get positive only when the liver damaged up to 60 or 70%. So most of the cases when the liver is damaged up to 50 or 60%, we don't find any major changes in the parameters. So once the liver get more of damage, it can't take more load. Slowly the readings will change. So SGOT, SGPT, liver function test we can do. Then fibroscan is one of the good method to identify liver health. So the fibrosis can be identified with fibroscan, cirrhosis and fatty liver changes can be identified.
Okay. Doctor, can you tell me about the Siddha approach to liver problems in general?
Okay, the liver, first of all, we have to manage the liver. First, we have to identify what is the problem in the liver. So, as I told, there is so much of conditions is there. So, fatty liver, that is very common in there. So, one of the factor, maybe all the conditions of the liver may not be necessary to take medications. Because, for example, some depreciation in the sleep patterns, that will increase the liver problems, because it will directly give damage to the liver, because in the present condition so much of people they are very less in sleep, they are will be very addicted to phone, and they will be only sleep at 2 o'clock or 3 o'clock like that, and they will have a short sleeping patterns also. So it is a direct impact to the liver to damage the liver cells, because liver is functioning because it is generating so much of heat in the body, because it is coming under the pitta predominant organs and all. So we have to be very careful on that, because our body wants so much of cooling to reduce the functions of the liver. So we have to be very careful on that, and there is some medications regarding each and every conditions. For example, for a fatty liver, there will be Kidarnelli tablet, that is Bhumi Amalaki, that is Philanthus neruri, that is very common plant that is available in our land also. That is very good liver protective, because it is very rich in iron, because liver, the iron is the mineral or metal that is very needed to, means in the herbo metal combination, it is a very good immune modulator for liver also. And so much of medicines like Karisale Lehium and Ayakanda Sandhuram, Ayachanduram, and Tipili Rasayanam also in conditions, because it is already in the yoga, it is mentioned that it is very good for this cholelithiasis, that is the stones that is available in this liver. So that is very important. So in the medication, we have to be very careful on which is the condition that is liver. If it is going to the cirrhosis level, definitely a thorough medication is needed. Second thing is, we must reduce the spicy foods from the diet, because we don't want any over filtration didn't give any over filtration today. Second thing is the junk foods. It is very incorporated with the colors and all. So it is, body is detecting like a toxin. So definitely the body will make, or the liver will make so much of time to filter this and all, to detoxify the body. So that causes an enlargement of the liver. So in our clinical practice, we will first palpate the condition, if the liver is enlarged or not. Second thing is, we will go for the parameters. Second, the USG abdomen scan to identify if the liver is enlarged or not. Because if there is any problem in the liver, definitely the size of the liver will increase and the production of the bile will increase. That causes some type of jaundice also, because every type of jaundice is not a parameter for liver problems. And so there is a slogan that liver opens to eye. So if there is any problem in the liver, it will be reflected in your eyes. So with the diagnostic purpose, we can see first eyes, then only we will see the nadi. And if the pitta is aggravated, we have to get rid of this pitta humor from the body. For that, medication is needed. So all the type of medication that is administration for the management of liver is anti-pitta in action. So that is the condition. So along with the diet and all, we can manage with the proper medication and all. But the main thing is Karisalanganni. There is Eclipta alba. That is one of the major plant that we can go for the liver management. So that is also available in the Siddha medications, that is widely used to manage the liver conditions and all.
Okay. What about Ayurvedic medications?
Liver is the seat of blood, Rakta. According to Ayurveda, Rakta Dhatu, the seat of Rakta Dhatu is said as liver. So, any medications which improve the quality of blood will definitely support liver. There are many blood purifiers, many medications which enhance the liver functioning, improves digestion, eases the pitta, which includes Ayupati Churna. A daily dose of Ayupati Churna will be helpful in conditions of liver. Then Patyapunanavadi Kashaya. Patyapunanavadi Kashaya is found very effective in many of the liver conditions. Along with that, Kaidaryadi Kashaya. Then Karisale, as doctor said, Karisale, it is one of a very important drug. Then Sudarshana Churna, Kirada Tikta, that is Kiryata in Malayalam. It is called. So Kirada Tikta is the main ingredient in Sudarshana Churna. Sudarshana tablet, which is usually commonly used for fever. It is more effective in liver conditions than fever. And then our patent medicine, Resolute Food. It is a very good medicine for improving out the liver function of the.
So in conclusion, avoid alcohol and avoid the usage of synthetic food colors. Even the government is regulating its usage. You only have one liver, so take care of it.